Butz from the Sioux City Journal, and I'm here with Tyler Brock, Siouxland District Health Department Deputy Director. And Tyler is going to answer 10 questions about COVID-19 vaccination. So Tyler, explain how mRNA vaccines work and how they are different from traditional vaccines.
Yeah, so the RNA, which is part of our genetic makeup, but the RNA in the vaccine essentially teaches our cells how to make a particular protein that's called a spike protein on the surface of our cells. This protein generates an immune response in our bodies, and we create antibodies. These antibodies then can fight the actual COVID virus if needed, hopefully protecting us from the infection. Other vaccines trigger an immune response by using a weakened virus or an inactivated form of the virus or bacteria. The COVID vaccine does not use live virus or even a weakened state of the virus. Additionally, it's important to note that the RNA in the vaccine does not actually enter the nucleus of the cell where our genetic material is kept, so there's no changes to the genetics of the cell. And additionally, the cell actually does break down and get rid of the RNA very soon after it's finished using the information to create that spike protein.
Okay. How effective are the current COVID-19 vaccines against the UK and the South African variants that are currently circulating?
Yeah, so far studies suggest that the antibodies that are generated through the vaccine with the vaccines that are on the market right now recognize these variants. Okay, so the vaccine should be quite effective against these variants. More research on that is ongoing, so more and more information is going to be coming up, but it's believed that our vaccine should recognize these variants.
Do you anticipate that those who have received the 2 shots will need a booster shot in the future, or will the vaccine be similar to how we vaccinated against influenza?
Yeah, right now that's just not something that's known yet. There's a lot of research still ongoing with that. It's too early to tell whether we'll need to do this more than once.
What side effects can people expect after receiving the first and then the second dose of a COVID-19 vaccine?
A sore arm is very common. Most people will feel it the next day that they got a shot. There might be some swelling at the injection site. Those are the 2 most common things. Some people may get fever, chills, headaches, body aches, fatigue. Other people have reported some people have reported some intestinal symptoms like nausea and vomiting. Again, they're not uncommon, but most people have very, very few significant issues with the vaccine.
What happens if a person gets the first dose and then doesn't come back for the second dose?
Well, you just won't develop quite as robust of an antibody response and likely won't have quite as much protection against the virus if you're exposed. There's still some protection from the first dose. Again, the jury's still out on how long that protection is going to last. That's still yet to be determined. But if you don't get that second dose, you're just not going to quite get that level of protection that would be ideal.
What would you like to tell people who are hesitant about getting vaccinated against COVID-19?
We understand that. We understand that it's understandable to be hesitant since the vaccine is using new technology and we don't know everything there is to know about it yet. So people need to make their own informed decisions. They may need to consult with their doctors to help them make that decision. But the information that we have right now indicates that this vaccine is an effective and safe way to protect yourself against COVID-19.
Can a person still spread the virus after being vaccinated?
So we can't completely rule out the possibility of that since no vaccine is perfect. Okay, there's always a small chance that someone could still get COVID and be infectious to others after getting vaccinated. But the vaccine lowers that possibility by significantly lowering the chances that you develop symptomatic infection. And so if we keep people from being sick, we're going to drastically lower the chances that they're going to spread that to somebody else.
After a person has received both shots, can they go out and associate with others? Should they still wear a mask?
I think that we have reason to be very confident in this vaccine. Both types that are currently on the market that are available to us right now have been shown to provide excellent protection against symptomatic infection. Because of this, you have a very low chance of being infected with COVID once you're fully vaccinated. And therefore, you have a very low chance of spreading COVID to others. So I really do think, and there may be some difference of opinions on this, but I really do think that if you're fully vaccinated, you should be okay to live your life as normally as you feel comfortable. Distancing and masks may add an additional layer of protection if you feel you need that. And of course, we always recommend good hand washing, good hand hygiene, staying home when you're not feeling well. Those are things that never go away. But again, we've got a lot of confidence in these vaccines, and if you're fully vaccinated, you are very unlikely to get symptomatic COVID, which means you're going to be very unlikely to spread it to other people. So living life fairly normally should be a reality for most folks.
Why are children not being vaccinated against COVID-19 at this time, and when might they receive the vaccine?
So right now, there just simply hasn't been enough research on the efficacy and the safety of the vaccine in children. And it's going to take a little while for that to happen. The other reason is kids also have not typically been at high risk for serious COVID infection, which puts them on a lower end of the priority list.
People who have received the vaccine at public vaccination clinics in Woodbury County, they seem really happy with the smoothness of the actual vaccination process, but others have expressed frustration with the sign-up process. Are there any tweaks that you're planning to make moving forward into the next priority group?
So we've made adjustments with every single week, and we're constantly making a few adjustments, trying to make sure that the audiences that we're trying to reach are being reached. Some of those adjustments involve making more appointments available via phone for those that can't navigate the online registration. Our county IT department, for instance, doesn't get enough credit for the way they've adjusted our phone systems and our website to manage high volumes. We're using the medical providers to help identify their highest risk patients and make it easier for them to get signed up. We admit that our system isn't perfect, but thousands of people have been successful using it, and we're fairly happy with how it's worked. The primary issue is not the sign-up system itself, it's that the demand for the appointments is greater than the number of appointments we have available. Vaccine supplies are the primary driver of appointments, and as long as the demand radically exceeds the supply, there's going to be a few people that just don't get in. Honestly, it doesn't matter how many people we have on a phone system if there are only so many appointments available. But it's going to get easier. More and more vaccine is going to become available in more places over the coming weeks. People have more choices in how and when they get their and where they get their vaccine. Again, we completely understand the frustration that some people are feeling. I mean, we're frustrated that we can't get the vaccine to everybody who wants it right now. But I can assure you, there are literally hundreds of people in the medical community that are committed to getting this vaccine to anybody that wants it. We wish it was faster. We'll get there, but we're just not quite where we are at the moment.
Okay, all right, Tyler, thank you so much for joining us.
Yeah, you're welcome. Dolly, is it